Welcome, everybody, to the Surgery and Therapy Summit and my interview with Dr. Donald Kramer. Don Kramer has done a few panel interviews for the summit, and it is just wonderful to have this opportunity to find out more about him, his career, his journey, and all the value that he is now being able to contribute to the world. Welcome, Dr. Kramer. Thank you so much for spending time with us.
My absolute pleasure.
So you are actually an anesthetist and your primary residence is in Texas, correct?
Yeah, although we just moved back to Paris, where I am going to step into the next stage of my career, which is I'm a high school teacher at the American School in Paris teaching entrepreneurship. And that's where my kids have graduated school. And I'm thrilled to do that in my retirement years.
That is wonderful. And of course, to live with, and immerse yourself in the French culture and the European culture and have all of Europe at your fingertips. It's just so
And
wonderful.
food. And food.
And food and wine. And you're closer to South Africa, so we can see you more, which is wonderful.
Great.
Okay, so you're an anesthetist. Tell us a little bit about your career. Why did you choose an anesthesiology?
Well, when I graduated medical school at the time, I went into primary care. And I was a primary care doctor for 8 years. And the big influences that young people have upon them often are from their professors and their peers. And it just seemed to me that primary care was the space that was the best, uh, most well rounded. It was about 7 or 8 years into my practice that I realized that I was then comfortable doing something more technically challenging and that would pay more. And I went back and did an anesthesia residency. Went up to Harvard and did a pain management fellowship, which was a new field at the time in anesthesia. I was in the first graduating class, and then moved down to Texas and started what became a fairly large pain management group in Houston.
That's wonderful because I've also worked in pain management, and it is a very complex area because you're dealing with so many things. You're not just dealing with pain, you're dealing with the whole person, everything that all their life experiences, their emotions, everything is involved in pain management. So I think it's such an important field.
It is, you tend to bring into it the bias of your parent field. So why would an anesthetist go into pain management? It's because we do all the epidurals for women that are in labor.
Yeah.
We do all the nerve blocks for surgeons that are going to be working on a particular limb. And as a result, they would send us patients who needed epidurals, but let's say steroid injections or nerve blocks for pain. The fellowship training programs are a joint venture between psychiatry, neurology, and anesthesia. So in that period of time, when you're a fellow, which is 2 years, you grow a lot into those other areas. But the anesthesia background tends to bring with it more of the technical regional anesthetic nature.
And of course, you are working in theatre with the surgeon, so it's bringing another diverse element into your practice.
Exactly. Exactly. Most guys will do surgical anesthesia in the morning and do their pain clinics in the afternoon.
Yes. Okay. And so then what happened after that? So you started running a few clinics, or you built these clinics?
So what happens is there are two places where there are the surgical theaters where these interventional procedures get done. One of them is general hospitals, which are pretty inefficient places to work.
Mm-hmm.
And the other are dedicated outpatient surgical facilities called day surgery centers. And those day surgery centers are set up for efficiency. And they're usually owned by groups of physicians that have banded together because no one physician has enough business to keep an operating theater busy full time. So we pulled together groups, and in my case, I joined a group of orthopedic surgeons, quite a few hand surgeons, and pain management doctors. We opened our own dedicated facility. Along the way, I realized I was enjoying the project. And one of the difficulties of medicine is that uh, it's not very project oriented on a daily basis. So you have your patients in various timelines of recovery in your practice and management. But if you look at your practice today and you look at your practice 6 months or 2 years from now, it may look quite the same. So the idea of working on projects where one sets up objectives and plans and then executes upon it and looks back and see where it had succeeded, where it hadn't succeeded, became pretty intriguing to me. So I found that I loved developing the surgical facilities and managing them as well. And I had the insight as both a practitioner as well as uh, somebody who lives in these spaces for his daily work. So that I was well received by groups of physicians who also wanted to open their own day surgery centers. And that became more or less a full-time business. And as you're probably aware, there was no such thing as a 20-minute meeting.
No.
And at the time when I opened my first one, I had young 2 or 3-year-old triplet girls, plus one other kid. And to be spending my evenings and weekends in business meetings was a huge toll on my family life.
Yeah.
And I find with nurses that if a doctor is running late because he's tied up in the operating theater or he's tied up in the hospital, the ICU, and as a result can't make it to clinic to see patients in the afternoon, the nurses will cover for the doctor. But if you're having business meetings and you're going to be running late for clinic, your nurses will kill you. It's just not the ethic to postpone clinic so that the doctor can have a business meeting.
Yeah.
So I found that I had to have all my meetings in the evenings and weekends. And as I said, it became exhausting with a full-time clinical practice. So eventually I had enough money coming in from the surgical facilities that I was able to hire some young people to take over my clinical load. And I can just focus on that one area.
And as you say, you have to have a very understanding wife during that time because, she
We had 4 little kids.
4
3
children.
of whom were 2 years old.
Sure. Triplets. That is
Yeah.
a full-time job. Okay, so that's wonderful. So I think I remember reading somewhere that you made her a promise at that time, didn't you?
Yeah, I did. That once we had enough money coming in from the surgical facilities, she wasn't sure if it would ever happen, that I would be able to cut back on my clinical practice and we could have a normal family life.
Oh.
And it worked out well. You know, what was interesting with my surgery centers is I looked for niches which were not being filled by our competitors. And it propelled us to become, in short order, the largest and most profitable surgical facility in Houston. Some of the niches that we did were pediatric tonsils on weekends and ear tubes on weekends so that the parents didn't need to lose a day of work.
Oh, that's clever.
We also once a month ran a very busy Saturday colonoscopy program. Okay. So again, people didn't need to miss a day of work. And then we came up with an idea that went off better than I had expected. Having been a family physician and knowing that most of the pain management was actually being cared for by primary care doctors and not pain clinics, I felt like I could train the primary care docs in our community to do a number of the basic surgical uh, and interventional injections in our uh, surgical theaters. And what that did was it expanded our base of available doctors who could
Mm.
work within our facilities, and it gave them an additional income stream. So by aligning us with people who are not traditional utilizers of our surgical facilities, we found that we expanded the pool of customers greatly. And that really drove our profits through the roof.
And it was a win-win situation for everybody.
Yeah, yeah, it worked out well.
I also like
It-
that there was role expansion because people like that. People like to take on more responsibility and to work in a role that is above their scope with the right training and skills, of course, skill
So
development.
in a larger group, whether it was an orthopedic group or a primary care group, there was often a young doctor that
Mm,
wanted to take on the role. Maybe they were doing sports medicine, but they wanted to take on the role of doing interventional pain training.
mm,
And then they would receive the referrals of the other members of their group. And then we had a very simple situation where they were the doctor of record. It was their patient. They did the procedure, but our anesthetist would guide them along like we would a first year resident. And their patient was sedated so we could have discussions openly. And no money changed hands. The doctors billed for the professional fees
mhm.
that were for their own patients. Our anesthetist wasn't charging for the mentoring program. And then there was a nurse anesthetist at the head of the bed who was actually providing the sedation. And it was a true win-win. And then the facility had more customers because it billed what was called facility fees.
So all of this led you to really grow multiple clinics.
Yeah, so I said, this is an interesting concept. It has taken off more than I ever thought it would. Maybe I can raise some outside capital and
Mm,
expand this concept into some other cities in Texas. And hired a banker, hired an attorney, and looked at what our fundraising options would be. And it seemed as though having a public offering, actually in Canada, because Canadians don't have the opportunity like Americans do to invest into private healthcare, because Canada is more or less strictly a nationalized health system,
mhm.
where the US is still a bit of the Wild West of medicine. So we raised our money in Canada and we
Okay.
did it in an IPO. And I stayed on as the CEO initially because I understood the business better than anybody else. But once we had the IPO, I was overwhelmed by the financial responsibilities.
Mm,
In particular, I had to change from cost accounting or cash accounting to accrual accounting. And I had to get set up for audits and all sorts of compliance issues, which they hadn't taught me in my anesthesia training.
no.
So I said, I really think the time is right for us to uh, bring in some outside management that has those skill sets.
Yeah. Well, none of us learn any of those skills at medical school. And it's really only when we start working and growing and developing new ideas that we realize that we often need to go back to school, which is what you did.
That's right. So shortly after the IPO and after I stepped down a few months later as the CEO, I went to the University of Texas and got my MBA. That was a 2-year program, and it was fantastic because uh, what an MBA program does is it changes the way one thinks. So in medicine, we have uh, uh, thought processes which we develop. We have a language we speak with each other, and we have a culture that is understood between healthcare professionals. And oftentimes you'll hear business people say doctors don't make good businessmen or businesswomen, and nothing could be further from the truth. But the truth is, we come at it with different skill sets, but different views, different cultures.
Mm.
And when one gets their training as a healthcare professional, they learn to think the way a healthcare professional thinks.
Yeah.
And when I went back and got my MBA, I learned to think the way not so much a healthcare professional in business thinks, but a general business person thinks.
Yeah.
During that time while I was in MBA, the company started to dwindle. And the company sued me saying that I had sold them a faulty business model. At the time, when we had our IPO, we had $47 million of revenue and $31 million of profit. And I sold off 70% of that profit. A few years later, the 40 million or $37 million of profit of revenue had dropped to 12 million. And instead of profit, it was running it with losses. And there were lawsuits that went back and forth. And I knew I was in the right. And I ended up reacquiring a controlling interest of the company, reinstituting the initial business model that had driven profitability, that the new management had no idea how to implement. And within the next 2 years, it had grown to $400 million of market value.
Incredible. Yeah, but it must have been a stressful time going through that lawsuit.
Oh, it was horribly stressful because I didn't have access to the documentation which would prove my case. But at the end of the day, we never even got to the point of depositions. The lawsuit went away. We regrew the company, which provided great value for the shareholders.
Mm-hmm.
And I was thrilled. And then I was not feeling very well, and I went to my doctor. And I was shocked. I think it was 53, 55, and I was given a diagnosis of leukemia. And that really rocked my world. And here I was, the CEO of a busy company with 4 young kids and a wife who I love very much. And now I wasn't sure what my prognosis was going to be. So I had brought back in with me at the time of repurchase of the company, my original management team that helped me regrow things. And it was a very tearful time between us. And I let them know what had happened and that I wasn't sure what my survival would be.
Mm.
And I stepped back down from the CEO role again. But this time I promoted from within the company so that we didn't change the culture.
Yeah.
And we decided to move to Paris, family, for 1 year, because I thought I wanted to create memories with them. If things didn't go well, hopefully we'd make it a year. And now I'm 10 years out and off my chemo, and my counts are normal. And
you're
we
good.
just had our 3rd grandbaby a few weeks ago, and life is beautiful.
But you see, it's because the world needs you. Your job is not done yet. There is still so much more for you to achieve. But this wasn't your only health scare. You had another health scare, which was also a big aha moment for you.
Yeah, that's true. That was at the time of our uh, initial IPO back in 2007. One of my dear friends, he's a radiologist. He had just gotten a new high-speed 64 um, cut CAT scanner that could read blood going through blood vessels. And he said, "Do you want to be my first patient on this new machine tomorrow?" And I said, "Absolutely love to." So we did what's called a heart scan. And he walked into the room with a very worried look and said, "Don, I got to tell you, you have what's called a widowmaker lesion."
Yeah.
I said, "What is that?" He said, "You have a big blood clot or atherosclerosis sitting at the split between the two major arteries in the heart. And I'm sending you down to Texas Heart Institute. You're not going home. I'm sending you down there for an emergency catheterization." So I saw my life passing in front of me. At the time, the triplets were only 2 years old. The other daughter was 7. And I was in the ambulance on the way to the hospital and remembered that I was just a couple years older than my father, who had died at age 52 of a very similar situation. And I prayed and I accepted the fact that I may never see my family again. It was very hard. But when I went and had the catheterization, for some reason, nothing was found. It was an overread on the
Oh,
CAT
wow.
scan.
Sure.
So in fact, my arteries were cleaner than he had seen.
Oh, wow. Well, that says something about the CAT scan and also about medicine a little bit, doesn't it?
Yeah, I thought about um, overcoming the odds. And I thought back to the very earliest part of my life, all the way back to my day of conception, when it was just me and 100 million other sperm swimming in the race for our lives. And I don't know whether I was the fastest sperm or whether I was the best looking sperm or that egg sitting inside her mom's ovary heard, "Pick him. He looks like he'll be successful." But for whatever reason, I was chosen on that day. And I like to think that every one of us are the chosen people, because just to even be born,
Yes.
I had to overcome insurmountable odds, as we all did,
Yeah.
so that anything else was negligible in comparison.
Absolutely. That's a beautiful story. And it's a good way to look at it. I think that things happen for a reason. And sometimes we might not understand it at the time. But in those moments as well, you always reset your priorities. You've always chosen your family. And that's what's important. You've realized, okay, this has happened to me, but what choice do I have now? You didn't just run right back to work and do more. You actually said, okay, I'm gonna take a year off. I'm gonna go to Paris. I'm gonna make memories. That's important.
I had as a chronic pain management doctor, which was my specialty in anesthesia, I spent a lot of time taking care of cancer patients and other terminally ill patients. And I had the opportunity, even as a young person, to hear them speak of their life regrets. And I never heard anybody say what they regretted most was that they spent too much time with their family.
No, never. Yeah, exactly. So you went on to listing your company on the stock market, but that was also an interesting story because your chosen name had already been taken and you had
And
to.
so when we went out on the Toronto Stock Exchange, which we did pretty much because that's where our investment advisors said we would do best,
Yeah.
because there was so much competition in the States, no competition in Canada. Well, we when we grew large enough, we had to be $250 million or larger to be listed in New York. Then at that point, we had to pick a name, which was Northstar Healthcare. And the NYSE came back and said that name was already chosen. So we hired one of my board members worked for a very large, prestigious branding company out of New York. And they came up with just horrible names, like Norco, which is the name of a narcotic, because it was Northstar Healthcare Company, or Norhico, which is just a horrible name. So there was a young guy that worked in our office. He was in his early 20s. He said, I suggest that you put it out there in India, that there are these websites for people that like to do logo and branding development.
Yeah.
And if you choose their name, you pay them something like $50 or $75. And if you don't choose their name, it doesn't cost you. Well, the branding company wanted, I don't know, $10,000 or $20,000 for that exercise. And I said to the young guy, Joseph, in our office, Joseph, sure, put it out there. And he did. And 2 days later, he came back with a whole bunch of names that were great. So we chose Nobilis Health, and largely because it was $50 and it sounded great. And that's really how our name got changed, and that's how we listed it on New York.
That's amazing. I love that story. I'd also just like you to give us a little bit of insight into how you select the experts and advisors around you, because you have many, and it's particularly when you bought your company back, you realized that the problem was with management, not the business model. You proved that. And you reinstated, having learned those skills, when you did your MBA. What qualities do you look for in the people that you choose to surround yourself with as your team?
Wow, that is a great question and fits in particularly well with my area of interest. So when you go to select employees, and key employees for sure, you need to look not only at attitude, but a lot at aptitude. There are organizations like the Gallup organization in New Mexico that Stryker uses exclusively, or others. There's a well-known book called Strength Finders 2.0, and they help you as the business owner develop a good set of job criteria. And I would say it doesn't matter whether you're picking your board members or you're picking your employees. The most important thing that one does is to develop a job description. Because when I first started out in practice 30 some years ago, I made the mistake that so many others make, which is I hired one or two people to work for me. I didn't really understand what their job roles would be. And I said, you people, you run the front office. And at that point, we were very small. So they also did the billing. And I said, because I'm busy practicing medicine.
Yeah.
Nothing could have been worse, because there was no accountability as to who was responsible for what role.
Yeah.
And at a certain point, the chaos in the office became too great. And I hired a practice management consultant who did a phenomenal job of helping us define the roles for each employee and giving them proper job descriptions and teaching us as business owners how to hold our employees accountable for their performance. And then we became organized, and only then were we able to scale our growth.
Mm.
And in the next 2 years, we went from 2 to 10 doctors. But we couldn't have done that without the structures that were put in place. And then the second half of the story is that it's one thing to hire people. It's another thing to onboard them.
Yeah.
Because onboarding is where you get maximal efficiency from your employees by having them understand not just the content of their job, but the context under which decisions are made so they can make good decisions. And a connectedness with the other employees and the whole culture of the institution. And I highly recommend that anybody who wants to grow a practice consider reading a book on onboarding, because it's such an important set of skills that you need for your organization to grow efficiently.
It's good advice, because you're only as good as your team. You know, everybody that's coming, they need to work all with the same goal in mind, all for the love of developing and growing that practice. Otherwise, you don't get to list on the New York Stock Exchange unless you have that.
Right. So how does a company like Starbucks, in a very, very decentralized way, onboard their employees so that you have consistency of experience?
Yeah.
And how do other organizations like the Marines, for example, onboard their recruits so that everybody is aligned on mission first rather than individual needs first?
Yeah.
And that whole paradigm change, because as physicians and as practitioners, you're the responsible person for the care in your practice, and you're paid for the work that you do. When you're in business, you're basically leveraging the work of others. So instead of being a great learner, which is what a practitioner is, you have to build a learning organization. And it's not intuitive. It's thinking differently.
Yeah.
With different responsibilities. When you're a practitioner and you're not quite sure what to do, you can send your patient to see a referral, see a specialist. And guess what? They pay for it. You don't.
Yeah.
When you're in business, you're dealing with a fixed pie of resources. Yeah. And those consultants come out of your own hide. So you have to be fairly broad in your knowledge and judicious on when you can use consultants, or else you'll go through all of your resources too quickly.
Absolutely. And especially when you're a startup, you know, this is a lot of what the summit is about, is helping people make decisions about whether or not they should buy an existing company, start their own company, where they should get the capital from, you know, how to fund different ventures. And so all of those decisions come together to, you know, to inform one of which direction to take.
You brought up a critical issue, which I often don't hear people speak of, but it's very important. So young people in particular tend to think that they should start something up. That's what an entrepreneur does in their mind.
Yeah.
But when you start something up, you not only have to be good at your skills, you have to understand human resources, finance, accounting, marketing.
Yeah.
And operational management, negotiating leases. And you can't get typical financing for those things unless you give personal guarantees.
Yes.
When let's say you develop, Robyn, new product or a new procedure that you feel would be great for hand practices. You could open a group of hand centers, and you would have to be good at each one of those skills that we discussed. And then you'd have to personally guarantee the leases
Yes.
and everything else for each of those facilities. Where if you look at buying an existing group of facilities, then with it, you're buying seasoned management that may be in place, processes that may be in place, and you then can focus on what it is that you know how to do and layer that on to um, the existing practices. And it's a much faster way to grow. Plus, you can get financing for the acquisition against the value of the asset you're buying. So you won't have to give personal guarantees on the banknotes. So whenever possible, it's great to look at buying existing businesses. Plus, you get to look at the business plans of each one of those centers. You'll get to see each facility that's for sale from the inside out. And, it's a faster way to learn about your industry than to learn it through trial and mistakes. So by getting that free look, you come out far, far ahead, even if you end up not acquiring something, where it can save you tremendous amount of losses.
And then you can leverage off that and scale. So then from that, you can then buy multiple businesses. We have a speaker at the summit, Philip Jepson, who's going to be addressing that particular issue. He's an attorney, but is buying engineering businesses. And yeah, it's that whole merger and acquisition and just growing and scaling.
It makes complete sense. It sounds intimidating for a startup to think about buying something, but there may be 100 reasons that somebody's selling.
Yeah.
And it's a great exercise to look at existing businesses before you think of necessarily going it alone.
And do you trade the stock market?
Do we?
Do you trade on the stock market? Do you personally take your money and invest in the stock market and trade?
So what I have is a really smart South African wealth manager who now lives in Houston, Texas. Okay. And we've agreed that I will take 2% of my net worth, and that is my money to play with on investments. It's not so much that I can hurt my family, but enough that I can enjoy trading and doing things in a safe fashion.
Oh, that's good. And are you involved in that process, or do you outsource it?
For the most part, I invest into, the wealth management company does a very traditional kind of asset allocation across a portfolio of categories. And for myself, I like to invest into startup businesses. But again, I restrict my total to 2% of our net worth.
Okay, that's wise. Yeah. And then this leads me to our next thing, because you're also very passionate about being a clinician again. You've kind of gone full circle in your career, and you're now the consul for Botswana. So would you like to tell us a little bit about that? How did you even dream up that role?
So most people aren't quite familiar with the role of a consul. So embassies are in capital cities.
Yeah.
And they are staffed with an ambassador. Oftentimes, they may have need for satellite offices for one of three reasons. They may have a lot of citizens from another country So let's look at Houston, Texas, where I live. There in France. We have a lot of Mexicans that live in Houston. So Mexico has a large consulate, which is the satellite office, so that they can provide services to the Mexican citizens that are living in South Texas. Second reason would be that there may need to be a lot of visas and paperwork and permits. So some countries may open consulates. So China, for example, had a large consulate in Houston because they would process lots and lots and lots of visas for people that wanted to go to China. And the third reason is to promote economic and other vital interests. And Botswana and Texas have a very rich history together. So our zoo is a major patron of the Cheetah Conservation Project. And all of our major universities run conservation projects of one sort or another in Botswana. But in particular for me as a physician, I became aware of the Texas Children's Hospital, which is the largest children's hospital in the US and one of the largest in the world, had been running pediatric HIV clinics for 20 years and had been very successful. And I knew a physician, a pediatric oncologist, who was interested in expanding the footprint beyond HIV into pediatric cancer. And I had been recently retired, and I joined with the Texas Children's Group. And we now have a pediatric cancer hospital in Gaborone in Botswana, one in Malawi, one in Uganda. And it's made profound impact on pediatric care in those countries.
That's Africa is such a beautiful continent, and to be able to reach out and to provide that kind of service is just a wonderful way to almost complete your circle.
So I reached out to the embassy in Washington when I learned what was going on and said, do you need a consulate in Texas?
Yeah.
Because I'm interested in some projects, largely in healthcare. And they said, come talk to us. And with that, I became their consul for Texas.
Amazing. Such a nice role.
It's been a blessing in our lives. It's been great for my family because my kids then don't end up with such a geocentric view of life.
Yes. Well, thank you so much for spending this time. And, I think you're going to give a lot of people some food for thought on so many levels. First of all, in terms of, being a medical practitioner versus being a business person, needing to go off and get those skills like you did to get your MBA skills, the whole concept of thinking big, being able to say, all right, I'm going to own 30 clinics that I created, I'm going to list it on the New York Stock Exchange. It's one of those things that really very few people get to achieve in life. And it's just so wonderful that you have also, through your expert guidance and through your experience, have been able to bring phenomenal experts onto this panel. One being Professor Doug Durking, who was one of your lecturers when you went to do your MBA, to name a few, and Phil Ayres has helped you, in terms of the marketing, the practices. So I think if everybody listens to those discussions, they can really piece together a full picture of where it could fit into their lives, because everybody will have something that will be applicable to them. So I'm so grateful that you have reached out to those experts and brought them on to help us, and also Leslie Davis, who's also a phenomenal leader, because we've spoken about leadership and how important it is to fulfill that role within ourselves and in our organizations and in our families, to be that great leader for them. So I could just thank you
for your very kind words, and thank you participants for allowing me into your lives for this short period of time.
Enjoy Telluride and also enjoy being in America before you embark on your new journey in Paris.
Thanks. God bless and stay well.
Thank you.